Welcome back, future nurses. Today we're diving into one of the trickiest NCLEX topics, cardiac drugs simplified. I've put together 50 high-level, exam-style questions that will truly test your knowledge and critical thinking. Each question comes with the correct answer, rationales, and strategies you can use on exam day. So grab a notebook, challenge yourself, and let's see how many you can get right without peeking at the answers. Are you ready to prove your NCLEX ready? Let's get started. Question 1. A client with atrial fibrillation is prescribed dofetilide. Which condition would require the nurse to hold the dose? A. Creatinine clearance 20 ml per minute. B. Potassium 4.2 milliequivalent/L. C. QTC 380 milliseconds. D. 2.1 Indian rupees. Correct. A. CRCL 20 ml per minute. Rationale: dofetilide is renally cleared and contraindicated in severe renal impairment due to torsades risk. Strategy: for antiarrhythmics, always check renal function and QT. Question 2. A patient taking spironolactone reports breast tenderness and swelling. Which action should the nurse anticipate? A. Add potassium supplements. B. Switch to eplerenone. C. Continue therapy unchanged. D. Increase loop diuretic dose. Correct. B. Switch to eplerenone. Rationale: eplerenone is more selective, avoiding gynecomastia. Strategy: link spironolactone to endocrine side effects. Question 3. Which finding indicates that ivabradine therapy is working in a patient with heart failure? A. Blood pressure increases by 20 mm of mercury. B. Resting heart rate decreases from 92 to 70 bpm. C. Potassium decreases to 3.0 milliequivalent/L. D. BNP rises from 200 to 600 pg/ml. Correct. B. HR decreases from 90 to 70. Rationale: ivabradine selectively lowers heart rate without affecting BP. Strategy: for ivabradine, target HR control in sinus rhythm. Question 4. Which adverse effect of nicardipine 4 infusion requires immediate discontinuation? A. Reflex tachycardia. B. Hypotension and acute pulmonary edema. C. Flushing of the face. D. Headache. Correct. B. Hypotension with pulmonary edema. Rationale: potent vasodilation can worsen pulmonary congestion. Strategy: prioritize acute decompensation signs over minor side effects. Question 5. A patient taking amiodarone is noted to have bluish-gray skin discoloration. What is the best nursing response? A. Document as benign and continue. B. Notify provider, this is a chronic adverse effect of therapy. C. Administer vitamin K. D. Apply topical corticosteroid. Correct. B. Notify provider. Rationale: photosensitivity with blue-gray pigmentation occurs with chronic amiodarone exposure. Strategy: no rare but classic drug-specific adverse effects. Question 6. The nurse should withhold metoprolol in which situation? A. Potassium 3.8 milliequivalent/L. B. Heart rate 46 bpm with dizziness. C. BP 138/90 mmHg. D. Oxygen saturation 95%. Correct. B. HR 46 bpm with dizziness. Rationale: beta blockers are contraindicated with symptomatic bradycardia. Strategy: always check HR and symptoms before beta blockers. Question 7. Which drug combination creates the highest risk for life-threatening hyperkalemia? A. Furosemide plus aspirin. B. Lisinopril plus spironolactone. C. Warfarin plus nitroglycerin. D. Amiodarone plus metoprolol. Correct. B. Lisinopril plus spironolactone. Rationale: both raise potassium levels significantly. Strategy: ACEI/ARB plus K-sparing diuretic dangerous. Question 8. A nurse is reviewing orders. Give adenosine 4 push over 1 minute. What should the nurse do? A. Administer as ordered. B. Clarify with the prescriber. C. Dilute in 100 ml NS and infuse. D. Mix with digoxin for synergy. Correct. B. Clarify with prescriber. Rationale: adenosine must be given as a rapid 4-push over 1 to 2 seconds, not slowly. Strategy: memorize administration techniques for unique drugs. Question 9. Which lab abnormality must be corrected before starting sotalol therapy? A. Sodium 134 milliequivalent/L. B. Magnesium 1 mg per deciliter. C. Calcium 9.5 mg per deciliter. D. Hemoglobin 11G/DL. Correct. B. Magnesium 1 mg per deciliter. Rationale: hypomagnesemia increases torsades risk with sotalol. Strategy: always think electrolytes with QT prolonging drugs. Question 10. A patient with STEMI is prescribed alteplase. Which nursing action is priority? A. Monitor troponin trend. B. Check neurologic status frequently. C. Assess ankle edema. D. Evaluate skin turgor. Correct. B. Neurochecks. Rationale: risk of intracranial hemorrhage is the most serious complication. Strategy: in thrombolytics, CNS bleeding is your top concern. Question 11. Which symptom indicates digoxin toxicity in a patient with heart failure? A. Constipation. B. Yellow-green vision changes. C. Increased urine output. D. Hypertension. Correct. B. Yellow-green vision. Rationale: visual halos are classic for digoxin toxicity. Strategy: always link digoxin to unique visual disturbances. Question 12. The nurse is caring for a client on milrinone infusion. Which finding is most concerning? A. Ventricular arrhythmias. B. Warm extremities. C. Mild hypotension. D. Headache. Correct. A. Ventricular arrhythmias. Rationale: milrinone can precipitate life-threatening arrhythmias. Strategy: prioritize arrhythmias over mild side effects. Question 13. Which teaching is essential for a patient starting isosorbide mononitrate? A. Take with food to avoid GI upset. B. Avoid abrupt discontinuation. C. Expect nocturnal angina relief. D. Report headaches immediately. Correct. B. Avoid abrupt discontinuation. Rationale: stopping nitrates suddenly can trigger rebound angina. Strategy: safety first, sudden withdrawal is dangerous. Question 14. A patient on warfarin presents with INR of 9.0 but no active bleeding. What is the expected intervention? A. Administer 4-protamine sulfate. B. Give oral vitamin K. C. Start heparin infusion. D. Continue warfarin as ordered. Correct. B. Oral vitamin K. Rationale: vitamin K is the reversal for supertherapeutic INR without bleeding. Strategy: remember reversal agents, protamine equals heparin, vitamin K equals warfarin. Question 15. A patient taking hydralazine reports joint pain, rash, and fever. Which complication is suspected? A. Serum sickness. B. Lupus-like syndrome. C. Stevens-Johnson syndrome. D. Raynaud's phenomenon. Correct. B. Lupus-like syndrome. Rationale: hydralazine can cause a lupus-like reaction. Strategy: link hydralazine plus lupus symptoms. Question 16. Which beta blocker is most appropriate for a patient with COPD and hypertension? A. Propranolol. B. Atenolol. C. Nadolol. D. Timolol. Correct. B. Atenolol. Rationale: cardioselective beta blockers, atenolol, metoprolol, are safer in lung disease. Strategy: avoid non-selective beta blockers in asthma/COPD. Question 17. The nurse should question which order for a patient with Prince-Metal's angina? A. Diltiazem. B. Nitroglycerin. C. Amlodipine. D. Propranolol. Correct. D. Propranolol. Rationale: non-selective beta blockers can worsen vasospasm. Strategy: Remember vasospastic angina equals use CCB/nitrates, avoid non-selective beta blockers. Question 18. Which electrolyte imbalance increases digoxin toxicity risk? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Correct, B, C, and D, multi-risk factors, but B is most classic. Rationale, low K, high Ca, and low Mg predisposed to digoxin toxicity. Strategy, memorize the triad of electrolyte risk factors. Question 19. Which is the most important teaching for a patient prescribed ranolazine? A. Monitor urine output closely. B. Report dizziness or QT prolongation symptoms. C. Take on an empty stomach. D. Expect reflex tachycardia. Correct, B. Report dizziness. Rationale, ranolazine prolongs QT interval. Strategy, QT monitoring is always high priority. Question 20. The nurse is preparing to administer 4-nitroprusside. Which precaution is essential? A. Protect 4-bag from light. B. Administer slowly over 1 hour. C. Flush with dextrose solution. D. Use a glass container only. Correct, A. Protect from light. Rationale, nitroprusside decomposes in light. Strategy, no unique drug storage requirements. Question 21. Which drug is most likely to cause angioedema in a client with hypertension? A. Enalapril. B. Amlodipine. C. Hydrochlorothiazide. D. Doxazosin. Correct, A. Enalapril. Rationale, ACE inhibitors can cause life-threatening angioedema. Strategy, ACEI angioedema equals airway emergency. Question 22. A nurse reviews orders, give 4-verapamil for wide complex tachycardia. What should the nurse do? A. Administer as ordered. B. Clarify with provider. C. Dilute in NS and give slowly. D. Premedicate with atropine. Correct, B. Clarify. Rationale, verapamil is contraindicated in wide complex VT. Strategy, always differentiate SVT versus VT before giving CCBs. Question 23. Which finding is expected in a patient receiving nitroglycerin infusion? A. Bradycardia. B. Mild headache. C. Cold extremities. D. Urinary retention. Correct, B. Headache. Rationale, vasodilation causes common but benign headaches. Strategy, distinguish expected versus adverse effects. Question 24. Which drug requires baseline thyroid and liver function tests before initiation? A. Amiodarone. B. Digoxin. C. Verapamil. D. Clonidine. Correct, A. Amiodarone. Rationale, amiodarone affects thyroid and liver. Strategy, know the organ toxicities for antiarrhythmics. Question 25. Which drug can mask hypoglycemia symptoms in diabetic patients? A. Furosemide. B. Metoprolol. C. Amlodipine. D. Lisinopril. Correct, B. Metoprolol. Rationale, beta blockers blunt tachycardia and tremors. Strategy, always caution diabetics on beta blockers. Question 26. A client is prescribed sacubitril/valsartan. Which prior drug must be discontinued at least 36 hours before starting? A. Spironolactone. B. Digoxin. C. Lisinopril. D. Furosemide. Correct, C. Lisinopril. Rationale, ARNI plus ACEI increases angioedema risk. Strategy, always remember the 36-hour washout. Question 27. Which assessment finding requires immediate discontinuation of clonidine patch? A. Dry mouth. B. Sudden rebound hypertension after missed doses. C. Mild sedation. D. Bradycardia 58 bpm without symptoms. Correct, B. Rebound hypertension. Rationale, abrupt withdrawal of clonidine causes hypertensive crisis. Strategy, teach adherence, withdrawal is dangerous. Question 28. Which adverse effect is linked to procainamide? A. Pulmonary fibrosis. B. Lupus-like syndrome. C. Gynecomastia. D. Cough. Correct, B. Lupus-like syndrome. Rationale: procainamide and hydralazine can cause lupus-like effects. Strategy: group drugs by rare but classic adverse reactions. Question 29. Which drug should not be given with sildenafil due to fatal hypotension risk? A. Nitroglycerin. B. Amlodipine. C. Digoxin. D. Metoprolol. Correct, A. Nitroglycerin. Rationale: PDE5 inhibitors plus nitrates equals severe hypotension. Strategy: always ask men about ED meds before nitrates. Question 30. Which adverse effect is unique to nizirotide? A. Thyroid dysfunction. B. Severe hypotension. C. Gingival hyperplasia. D. Tinnitus. Correct, B. Severe hypotension. Rationale: nizirotide, BNP analog, causes profound vasodilation. Strategy: no drug-specific critical adverse effects. Question 31. Which patient is at greatest risk for statin-induced rhabdomyolysis? A. On simvastatin plus erythromycin. B. On atorvastatin plus aspirin. C. On pravastatin plus lisinopril. D. On rosuvastatin plus furosemide. Correct, A. Simvastatin plus erythromycin. Rationale: CYP3A4 inhibitors increase statin toxicity. Strategy: always check for dangerous statin interactions. Question 32. Which finding suggests digoxin immune fab is needed? A. HR 88 BPM. B. K plus 7.0 milliequivalent/L. C. Nausea only. D. 3 Indian rupees. Correct, B. Potassium 7.0. Rationale: severe hyperkalemia is an indication for digoxin antidote. Strategy: no fab indications, severe arrhythmia, hyperkalemia, massive ingestion. Question 33. Which lab should be monitored closely with eplerenone? A. Potassium. B. Hemoglobin. C. Platelets. D. Calcium. Correct, A. Potassium. Rationale: like spironolactone, eplerenone causes hyperkalemia. Strategy: group aldosterone antagonists equals K monitoring. Question 34. The nurse should avoid giving labetalol for push in which condition? A. Hypertensive emergency. B. Asthma exacerbation. C. Tachyarrhythmia. D. Preeclampsia. Correct, B. Asthma. Rationale: non-selective beta-blocker bronchospasm risk. Strategy: asthma plus non-selective beta-blocker equals red flag. Question 35. Which drug requires monitoring for optic neuritis and pulmonary toxicity? A. Amiodarone. B. Digoxin. C. Ethambutol. D. Procainamide. Correct, A. Amiodarone. Rationale: amiodarone has ocular plus pulmonary toxicities. Strategy: recall multiple organ toxicities. Question 36. Which calcium channel blocker is safe in heart failure with reduced EF? A. Amlodipine. B. Diltiazem. C. Verapamil. D. Nifedipine. Correct, A. Amlodipine. Rationale: only amlodipine/felodipine are safe, others worsen HF. Strategy: HF patients cannot tolerate most CCBs. Question 37. Which drug requires continuous ECG monitoring during initial 4 infusion? A. Furosemide. B. Amiodarone. C. Lisinopril. D. Atorvastatin. Correct, B. Amiodarone. Rationale: risk of arrhythmia during loading dose. Strategy: only high-risk antiarrhythmics require ECG monitoring. Question 38. Which complication is linked to dobutamine infusion? A. Severe hypotension. B. Tachyarrhythmias. C. Constipation. D. Cough. Correct. B. Tachyarrhythmias. Rationale: dobutamine increases HR and risk of arrhythmias. Strategy: associate inotropes with arrhythmias. Question 39. Which drug increases risk of lithium toxicity when combined with lithium therapy? A. Amiodarone. B. Hydrochlorothiazide. C. Metoprolol. D. Digoxin. Correct. B. Thiazides. Rationale: thiazides decrease lithium clearance. Strategy: watch drug-drug interactions with lithium. Question 40. Which nursing action is priority when administering 4-adenosine? A. Use a central line only. B. Flush with rapid 20 ml NS immediately. C. Give slowly over 1 to 2 minutes. D. Mix with epinephrine. Correct. B. Flush rapidly. Rationale: adenosine must reach the heart quickly to work. Strategy: technique is crucial. Question 41. Which drug may cause torsades de pointes as a side effect? A. Amiodarone. B. Dofetilide. C. Metoprolol. D. Diltiazem. Correct. B. Dofetilide. Rationale: class 3 antiarrhythmics prolong QT. Strategy: always connect torsades with QT drugs. Question 42. Which drug is most appropriate for rate control in atrial fibrillation with HF? A. Diltiazem. B. Metoprolol. C. Digoxin. D. Verapamil. Correct. C. Digoxin. Rationale: digoxin is used when HF limits use of CCBs or beta blockers. Strategy: pick digoxin when other agents contraindicated. Question 43. Which drug interaction increases bleeding risk in patients on warfarin? A. Rifampin. B. Phenytoin. C. Amiodarone. D. Carbamazepine. Correct. C. Amiodarone. Rationale: amiodarone inhibits warfarin metabolism, INR. Strategy: always recall CYP interactions. Question 44. Which cardiac medication is contraindicated in pregnancy due to fetal toxicity? A. Methyldopa. B. Labetalol. C. ACE inhibitors. D. Hydralazine. Correct. C. ACE inhibitors. Rationale: ACEI/ARBs are teratogenic. Strategy: memorize safe versus unsafe pregnancy drugs. Question 45. Which adverse effect is linked to chronic amiodarone therapy? A. Alopecia. B. Corneal microdeposits. C. Gingival bleeding. D. Hearing loss. Correct. B. Corneal microdeposits. Rationale: amiodarone causes visual halos from corneal deposits. Strategy: I plus lung plus thyroid equals amiodarone. Question 46. Which drug is first line in hypertensive crisis with pheochromocytoma? A. Labetalol. B. Phentolamine. C. Hydralazine. D. Nitroprusside. Correct. B. Phentolamine. Rationale: alpha blockade is required. Strategy: treat pheo with alpha blockers first. Question 47. Which drug requires patient teaching about flushing, pruritus, and warmth after administration? A. Niacin. B. Atorvastatin. C. Gemfibrozil. D. Ezetimibe. Correct. A. Niacin. Rationale: prostaglandin-mediated flushing is classic. Strategy: teach patients that flushing is expected. Question 48. Which lab abnormality is associated with long-term loop diuretic use? A. Hyperkalemia. B. Hyponatremia. C. Hypercalcemia. D. Hypouricemia. Correct. B. Hyponatremia. Rationale: loop diuretics cause Na and K loss. Strategy: always check electrolytes with diuretics. Question 49. Which 4 drug is contraindicated in a patient with systolic heart failure and pulmonary edema? A. Metoprolol. B. Morphine. C. Dobutamine. D. Nitroglycerin. Correct, A. Metoprolol. Rationale, beta blockers worsen acute decompensated HF. Strategy, avoid negative inotropes in acute HF. Question 50. Which patient teaching is correct for nitroglycerin sublingual tablets? A. Store in a bathroom medicine cabinet. B. Take with water immediately after placing under tongue. C. Replace bottle every 6 months once opened. D. Chew the tablet for faster effect. Correct, C. Replace bottle every 6 months. Rationale, nitroglycerin loses potency after exposure to light/air. Strategy, teach safe storage and replacement. And that's it. You've just completed 50 of the most difficult NCLEX questions on cardiac drugs. Syringe Red Heart. How many did you answer correctly? Was it 20, 30, or did you crush all 50? Trophy. Drop your score in the comments below, I'd love to see how you did. If you found this helpful, don't forget to hit that like button, subscribe for more NCLEX made easy content, and share this with a friend who's also preparing. Remember, every practice question gets you one step closer to passing the NCLEX with confidence. See you in the next video, and good luck future RNs, you've got this.